Dr. Wilson in North Carolina is really into alternative medicine. He detected a murmur and said, we need to get an echocardiogram done. Do it at Vanderbilt. Vanderbilt's a good place. So I went in there, got an echocardiogram done, and didn't think anything of it. Results were sent to Dr. Wilson, and he said, you need to further this.
Diane had a mitral valve prolapse, which is an abnormality with one of the valves in the heart. Many people who have this will never need attention. However, if you develop it to the point that Diane did, where it's a threat to the function of your heart, then you really do need to address it.
I just remember a young lady that has a problem that she didn't want to have and was afraid of having it fixed. So our main goal was to explain to her what we were going to do. We were going to try to repair the valve instead of replace it so that she wouldn't have any artificial tissue. And after a certain period of time, she basically can live a relatively normal life. And that her chances of doing well were very good, to try to alleviate her fears a little bit.
I always said, and this is my faith, and I'm going to lose it. I always said, thy will be done. And as I said that in my head, I thought, well, before Dr. Petrasic left, one touch that he gave me, and it was that healing hand of touch. He said, well, take care of you. And I went, oh, wow, they'll take care of me.
Everybody is going to have a open heart surgery. That's a big deal. It's a scary thing. You suddenly feel your immortality is going out the door, especially young people, that they suddenly have to have their heart operated on. Then when you try to start explaining to them what you're going to do, that you're going to stop their heart, you're going to cut their heart open, and put them on a machine that's going to take over their heart and the lungs. You know, we do it routinely and don't think a whole lot about it. But if this is the first time you've heard about it and it's going to happen to you, it is frightening.
He said, oh, we can do this minimally invasive. I'm almost 90% sure. So I'm always questioning, well, what's that 10%? Then when we ask, well, what does it mean in minimally invasive? It basically is this, they just go on the side. And because it was my mitral valve, they can. Had it been my aortic valve, they would have had to open up the chest.
Not only is it less invasive, but the patients do better. And I really feel I can actually do a better job this way than I could the old style method of treating mitral disease. So it's a win-win situation, and you talk to young people and try to encourage them to not be quite so scared.
She's a tremendously open person, and I think that kind of openness is always a pleasure. And the strength with which she was able to really overcome a tremendous amount of apprehension in her case and go through this, as well as dealing with the rehab afterwards, was really, it was extraordinary. It has a happy ending. I think that's the best part of the whole thing.
It was true care. I felt as though I was part of their family, and they didn't know me from Adam. You know, I was someone that walked in that I needed help. So my way of touching right now is at night, I just lift them up in a prayer. And I truly do that because I'm so grateful.